Good things often come out of hard times, and such was the case with PacificSource. The Pacific Northwest was a vastly different place 90 years ago. The Great Depression made life challenging, and for those fortunate enough to have jobs, the work was often backbreaking. However, the logging industry was vital and employed thousands of people, all of whom needed medical care and the means to pay for it. During 1933, a group of Eugene, Oregon physicians established Pacific Hospital Society, a not-for-profit organization to provide health insurance for local businesses and their employees. In 1934, we covered 600 lives at $1.25 per month, mostly logging and government contracts. At the time, hospital rates were $18 per week and office calls cost $1.50. In the words of Max Wright, our manager from 1936 to 1965, we paid 100% for practically everything. The company reincorporated in 1939 and was renamed Pacific Hospital Association. Slow, steady growth and solid resources made Pacific Hospital Association an attractive company in the 1940s. By 1945, we insured 4,500 working men and women at $2 per month. In 1947, we offered our first family coverage contract to Associated Plywood. As the country entered the post-war boom of the 1950s, we continued our steady growth, mostly in the timber industry. We celebrated our 20th anniversary in 1953 with 10,500 members. Premiums had risen to more than $4, and hospital rates reached $13.25 a day. In 1964, the physicians at the Eugene Hospital and Clinic joined Pacific Hospital Association as member doctors. In 1969, new contracts were developed for small groups and individuals to meet competition in the marketplace. By 1975, our premiums and contract benefits were becoming more competitive. Name familiarity was growing due to advertising and word of mouth, and we began to expand our provider network in Lane County. In the 80s, the health insurance industry experienced increased utilization, and many carriers raised premiums dramatically in response to large claims losses. Thanks to selective marketing and conservative underwriting practices, we avoided large losses and continued growing steadily. As the company grew, we were in need of more space to accommodate our employees. In 1985, we purchased 60,000 square feet of property on Country Club Road in Eugene for the construction of a new office building. The 80s also brought changes to the industry as small insurance companies began to merge. This created an opportunity for us to set our sights beyond Lane County. With our market expanding, we decided to adopt a name that more accurately represented our company and the services we offer. Many names were considered, including Pacific Integrated Healthcare and PacificSource Health Systems. Ultimately, PacificSource Health Plans was chosen to let people know that we are their source for health insurance. As our market expanded, we also worked to build a larger provider network. We opened a Portland office in 1992, and by the late 1990s, we had become a statewide plan, providing businesses and individuals in all corners of Oregon with flexible health and now dental insurance. The 2000s brought widespread growth to our company. We opened our Bend office in 2000, and we moved into our new building at 110 International Way in Springfield in 2003. That same year, we enhanced our position as a market leader and source for innovative benefit solutions by acquiring 2 third-party administrators, Manley Services, an administrator of flexible spending accounts, health reimbursement arrangements, and COBRA benefits, and Select Benefit Administrators, an administrator of self-funded employee benefit plans. In 2007, We achieved a key goal of our expansion strategy by entering the Idaho market and opening a regional office in downtown Boise, Idaho. We celebrated our 75th anniversary in 2008, ending the year with 150,000 covered members and newly acquired licensure in Washington. In 2009, we completed 2 strategic acquisitions. We purchased Advantage Dental's commercial dental business, which expanded our dental membership. We also acquired Primary Health Incorporated of Idaho, which included Primary Health Plan, Riverside Benefit Administrators, and Idaho Physicians Network. This significantly increased our Idaho presence. Through this growth, PacificSource finished 2009 with 206,000 members. In keeping with our vision of becoming the leading community health plan in the region, we entered the Medicare and Medicaid markets in 2010 through the acquisition of Clear1 Health Plans Incorporated. At the time, Clear1 had 9,500 Medicare Advantage members and about 29,500 Medicaid members in Central Oregon and the Columbia Gorge. With Clear1's expertise in government programs, this union was the foundation for PacificSource Community Health Plans, our Medicare company, and PacificSource Community Solutions, our Medicaid company. It also helped us become a true community health plan, giving us the ability to more effectively collaborate with healthcare providers to improve quality of care and provide health coverage to members throughout their lives. 2010 also brought great change to the healthcare marketplace with the passing of the Patient Protection and Affordable Care Act, which would roll out in 2014. In 2011, we purchased the commercial business of New West Health Plans in Montana, opened an office in Helena, and achieved licensure in Montana. PacificSource Community Solutions became the Coordinated Care Organization, or CCO, in Central Oregon and the Columbia Gorge in 2012. This was an exciting step forward in our effort to create a more effective healthcare delivery system. We also expanded our Medicare products to southern and southwest Idaho, as well as Lane County in Oregon. We expanded further in 2013, offering products to northern and eastern Idaho and the Oregon coast. As the ACA rolled out in 2014, we began to offer products on the health insurance exchange and significantly grew our individual business. In 2015, we expanded Medicare Advantage to Portland, Oregon. In 2016, we entered into a unique partnership with Legacy Health, aligning our strategies, marketing efforts, and population health work. This strategic partnership allows us to better engage and serve our members, and it strongly supports our ongoing efforts in population health management. In January of 2017, we became the administrator for the self-insured Legacy Employee Health Plan. With the addition of LEHP and other business, we finished the year with 288,000 members. In 2017, we also celebrated our 10-year anniversary of doing business in Idaho. In 2018, we expanded our Medicare product to Billings, Montana, and Vancouver, Washington. Billings Clinic moved employee health to PacificSource in January of 2018, and we became a member of the Alliance for Community Health Plans, an association of not-for-profit community health plans from around the country. We opened offices in Tacoma and Spokane in 2018 to support our Washington expansion strategy. We also entered into a partnership with MultiCare, a health system serving Tacoma and Spokane. As part of that partnership, we introduced Medicare Advantage products in those markets. In Oregon, we were awarded CCO contracts in Lane and Marion-Polk counties, as well as subcontract in Portland with our partner, Legacy. With a continued focus on growth strategies, we finished the year with 326,000 members. 2020 brought even more growth. In January, our new CCOs became operational in Portland and in Lane and Marion Polk counties, bringing our total CCO membership to 229,000. This resulted in total membership of more than 500,000 members. To support our significantly expanded CCO in the Willamette Valley, we opened an office in Salem. In early 2020, the COVID-19 pandemic hit the United States. We moved quickly to keep employees safe, providing assistance and support that allowed them to work from home. We also provided flexibility, relief, and enhanced benefits to employer groups and members, and provided financial assistance to providers and communities. Later that year, we released a statement on racial justice and added a value to support social justice, diversity, equity, and inclusion, and launched a major initiative focused on diversity, equity, and inclusion, or DEI. That fall, we moved into our new state-of-the-art offices at 555 International Way in Springfield. We expanded Medicare to Missoula, Montana in 2021. In 2022, we launched dual special needs plans in Central Oregon, the Gorge, Portland, and Lane County, and we expanded Medicare Advantage to Douglas County, Oregon. We also proudly celebrated 10 years in Montana. Today, we are a full-service organization with licensure in 4 states and 14 offices throughout the Northwest. We proudly serve 604,000 members. Offering health coverage solutions for individuals, small companies, large organizations, Medicare and Medicaid, we are well positioned to expand on our role as a community healthcare asset that can meet the needs of all community members. In 1933, our founders recognized the need to help people access affordable and effective health care. 90 years later, our mission remains the same.